Hello, this is Dr. Jason Acevedo here to talk to you today about bone-anchored hearing aids. If you're watching this video, you or your loved one is probably scheduled to have placement of a bone-anchored hearing aid, and this short video will just describe the basics of bone-anchored hearing aids, what to expect after surgery. And to begin, so a bone-anchored hearing aid is a very special device used for patients with a very specific pattern of hearing loss called a conductive hearing loss. And what a conductive hearing loss is when your inner ear still works relatively well, but sound just has a hard time getting down to the nerve. And that can be seen in patients that have had chronic infection, patients that have had prior ear surgeries, cysts in the ear, anything that doesn't allow sound to properly conduct to the inner ear. The bone-anchored hearing aid works very well for that. Or in some cases, we'll utilize a bone-anchored hearing aid for a patient that has good hearing on one side, but no hearing on the other. And in those cases, that bone-anchored hearing aid can be implanted on the bad side to transmit sound to the normal hearing ear. Regardless of the cause, the procedure is the same, and it is done with general anesthesia so that you or your loved one will be totally asleep, won't feel anything, won't remember anything. And it's a very simple, very safe procedure. And once the patient is asleep, all we do is do some measurements behind the ear. The implant is placed just behind the ear on the affected side, just enough to where it sits below the top of the ear and far enough back so that it doesn't make contact with the external ear. And once our patient's off to sleep, like I said, we do some measurements, some numbing medications, make a small little incision through the skin right down to that bone behind the ear. Well, from that point, I use a tiny little drill to drill a hole and place what's called an abutment into the bone behind the ear. That abutment is the anchor that will hold the bone-anchored hearing aid. After that, just put a small dressing on, wake up, keep our patient around for about 30 minutes, and then let them go home. So it is a same-day surgery. Your patient, whether it's you or your loved one, will go home with pain medication as well as an antibiotic. In the grand scheme, it's not an extremely painful surgery compared to some others, but I do still tend to send patients home with some pain medicine as needed. It's not required to take it. The antibiotic I do like to use just because I'm really diligent about preventing infections with these procedures. And then as far as the recovery, typically you or your loved one will be up on your feet within 24 hours doing most of your normal daily activities. I would say back to work or school within 48 hours. Not a lot of restrictions. The biggest thing is no contact sports or vigorous physical activity, anything that would bump that area where the abutment was placed. Showering and bathing, you do want to minimize water exposure that first week. So when you shower or bathe, sometimes the best thing to do is just to put a cup over the ear. That prevents the wound cavity or the wound site from getting wet and minimizes the risk of infection. But outside of that, it doesn't require a tremendous amount of aftercare. We do typically wait about 6 weeks for the implant to fully heal before we attach the external portion, the actual hearing aid. And when you come in for that appointment, what will happen is our audiologist will program the hearing aid based on your previous hearing testing and hearing loss. And then once the external portion is attached, sound will conduct into the ear, and the significant improvement in hearing will occur right away. Complication-wise, very safe, very few complications. You know, any surgery we do, we always mention bleeding, infection, and pain as the risks. Bleeding is very rare with this surgery. Pain is relatively minimal. Infection is very rare, but we do take it very seriously just because it is an implant. It's not part of your body, so if it does get infected, it can be a tough problem to deal with. But outside of that, like I said, it's a very safe, very effective procedure, and whether it's you or your loved one, it should tremendously help with the hearing.